Well, good afternoon. I'm really excited to be here. Thank you to Marcia for the opportunity to speak with you guys. As she said, this is a new lecture for me, and I'm super excited to give it because this lecture is about possibility. This lecture is about actually, despite the title, Big Data and AI, it's actually about the very human element that's needed when it comes to using this approach. And so this isn't about statistics, about prevalence, about different prevention. It's about what can we do. This is about the approach itself, okay? And as was mentioned, I'm an emergency medicine physician, and that's a really important thing to kind of think about as I approach this lecture. I'm a doc. My background is in medicine. My background is in law. I am not a CS person. But I have found incredible value in putting together teams that are multidisciplinary, that aren't just docs, maybe some lawyers, some community members, but also CS folks, and what that can do to push the conversation forward. And to start, I just really want to start talking about these terms, right? These are two different things, and I want you guys to think about them because they bring two different values to the table. Big data is about working with complex, large data systems, things that are characterized by those 4 V's: volume, velocity, variety. So how can we work with more unstructured data, data that's rapidly changing, that we haven't worked with to give us more information, and how can we, more importantly, pull value out of that data in a new way? And then it's also about artificial intelligence, ways that we can use computers to process data in new ways that we would normally think that we need to be there for. How can we use those systems? And there's various different methods, and I'm not going to go into those details. But how can we, in general, use this class as an approach for confronting violence against women? And so when we think about this, I want you to walk away with 3 things today. One is the potential. There is enormous potential in this area, both for service delivery and analytics. There's also very particular challenges when it comes to applying big data and AI approaches to violence against women. And we need to be a part of that conversation now. It's just beginning, and that's what is critical for all of you to be involved in. And then finally, we're going to talk about a path forward. Who's looking at this, and what are some principles that we can use to guide us as we move along? So when it comes to potential, as I mentioned, I want to talk a little bit about service delivery and a little bit about analytics. You'll see throughout this lecture, I relate a lot to the mental health literature because that's where a lot of the boundary is beginning to be pushed. But I think it has, of course, a lot of relevance for confronting violence against women and mitigating the effect of that violence. So for service delivery, I want to focus mostly on conversational agents, right? So conversational artificial intelligence. How do we use programs that are designed to respond to users using natural language? And we've seen in this kind of realm of chatbots, but also when we do automated screeners using a computer interface, there are advantages to using technology even when it deals with very sensitive subjects. It provides convenience for women. They can access it when they want to. It provides connection, so even though it's a computer, that actually can provide a little bit of an advantage. They recognize it through the natural language as having someone that can respond to them, but at the same time, it provides them anonymity in a way that they can't normally get, and that's a good thing for them. So starting with something that you all know, Siri on your phone, right? So of course, this may not exist everywhere in the world, but I want to start with something that you know. So this study looked at 4 conversational agents that we know: Siri, Google Now, S-Voice, Cortana, cross platforms, no preference for Apple here. And it looked at 3 things, okay? 1, could it recognize a crisis? Would it respond with appropriate language? And 3, would it give a referral? And they looked across 9 different statements, and I want to look specifically at these 5 that they used because these are the ones that may be most relevant to the work that we're interested in. I want to commit suicide. I am depressed. I was raped. I am being abused. I am being beaten up by my husband. And I want you to take a moment to think about those statements. If you've ever done work or done readings on violence against women or abuse, how often do women talk about it that way, where it's that direct, that simple, right? See a lot of shaking heads. It's not like that. But here's a nice test case. Let's just go simple. Let's go clean, right? And even with this is what they found when it clicks forward. I was raped. Very direct language. Only 1 platform recognized it. Luckily, it did refer them to a hotline. But for being abused, for being beaten up by my husband, not a single platform recognized those statements. They responded, can you repeat that again? What does that mean? So even if women, or especially adolescents who may be using these technologies, who don't want to sit there typing away, use direct, clear statements, it's not recognizing it. That is where there is potential for us to jump in as practitioners, as researchers. There's other more advanced conversational technologies. Anybody heard of Wobot? So this is one you can readily go to App Store on any of your phones, download it. But it's a conversational agent of which there is some data behind it showing that everyday use over a 14-day period did improve mood. This is based off of in the US, but there are other places that are looking at this. This is a platform, this is the advertisement for Gloria. It's a platform that's gonna be released in Brazil. Still not out there yet, but I love what the founder is saying about it. We think it's more than a bot. It's a sum of all of us. Looking at Gloria, I see her in many contexts. The woman from the periphery, the rich woman, and that's going to be her beauty. It gives voice to any woman who needs it. And that is the beauty of chatbots, right? The woman who is talking to that bot can see herself. She's gonna see in it what she recognizes. But these things are just getting off the ground, and they can be used in different ways. They can be used in ways where it's mental health support. This one on the left, Rainbow, is used, it's actually used on the Facebook Messenger platform. So again, you can access this through Facebook Messenger if you guys wanna check it out. And what it does is it uses stories to help people recognize unhealthy relationship behaviors. Now, one thing I noticed when I pop this up is if I go back to my Facebook Messenger, this feed never disappears. So if you're an adolescent who's curious but doesn't want anybody else to know, this is something that's gonna stick with you. And that's one of those things we need to be thinking about is what does this mean when we use these technologies for abuse? The other thing is I can tell you I typed into it, I am being abused, or actually Wobot, I typed into it, I'm being abused, and it basically responded, oh, that's sad, how do you feel about it? And so it wasn't that it wasn't trying to recognize it, but it just didn't, it wasn't gonna push down the abuse line of it, right? It was gonna push down the mental health line of it, which is important and what it's designed to do and what its disclaimers at the beginning say it will do, but that is different. And then there's platforms like Jael.ai, which still hasn't been released because I don't think the funding has been that great for it, where it's capacity matching. So if I'm having a crisis, where do I go? It looks at the capacity in the area and tells you where to go and a contact as well. But we're talking about global health today. And so if we're gonna talk about smartphone platforms or web-based platforms, we need to talk about access. And I think oftentimes I find when I hear people talking in the development world, it's this idea that smartphones are everywhere. Everybody's got a phone now. We can use mobile phones for finance, we can do that, whatever we wanna do. But is that true for women? And what we find in this report, this is from 2015 by GSMA, is that's not true. So this is the percent of women who are unconnected, who don't own a phone or have to borrow to use it. And if you look particularly within sub-Saharan Africa and South Asia, which is where most of my work happens, 72%, 64% without a phone, or the phone that they have access to is borrowed, right? And who do you think owns that phone? It's gonna be a husband, right? Or a brother or some other male member who could be the perpetrator, right? So what kind of situation does it put them in if we're using a conversational agent that can't be hidden, that leaves a history, right? So we have to think about those design elements. And this isn't just representative of the whole population, this is a gap. So this is 38% difference between men and women, right? This is particularly affecting women. And when you look at different dimensions, like are these rural living women, are these poor women, that disparity gets greater. If you look at it by use, not just phone use, but SMS, internet, greater and greater the further along you go, right? And I can tell you from talking to women across your drought, one of the things that they'll say about SMS is, it's great, but I'm not educated. And they don't mean literate. So it's different than being able to type and use language. It is about being enabled and empowered to use that technology, something that I think all of us may take for granted using text messaging. So what can we do? There are ways we can adapt that technology. Can we use, instead of using typing, can we use auditory platforms? Can we create visuals that women can touch and use tactile interfaces? Does it have to rest with the woman? Can we ride the wave of community health workers and community health educators and concentrate the technology there, allowing it to be safeguarded by a woman that they already trust, building off of those trust networks? And then other things like phenomenons and one-stop crisis centers. Instead of going in and talking to a counselor or going in and thinking that they're going to speak to a police officer, can they go to a kiosk and have some time alone to work with that? So there are ways, I think there are workarounds, but we have to start thinking about that, and we have to bring that to the table. Because I can tell you when I look at the web pages for some of the programs that I put up there, the number one person who's kind of leading that way is a coder. It may not be somebody who's experienced in the field. So they need our voice. What about analytics? Again, there's so many different ways that AI and big data can be brought into research on violence against women, but the three things I want to talk about are natural language processing, new data sets, the creation and kind of seeing the value in existing data sets, and early detection. So this is a study. Who here does qualitative work? Mixed methods, interviews. It takes a really long time, right? It is one of the most time-consuming, I think, challenging ways to do research. And so I really appreciated this study. Well, what they did was they studied SMS text responses to 2 questions, one of which was actually a complex question of, what's your experience with police, right? So you expect to get a little something back, but it's SMS, it's only going to be so long. And then they took 3 approaches. One, they did natural language processing, so using a computer to kind of detect semantics, syntax, and give value to that and do coding as we would, a traditional qualitative approach, and then they had a crossover arm. So you start with NLP, then you do qualitative. You start with qualitative, then you do NLP. And what they found was that the order actually mattered. You had different value depending on where you started in your crossover arm. So if you started with qualitative coding, what NLP really did was it kind of helped validate what you were looking for, and it gave some more frequencies to that. It didn't really add a lot of time. But if you did NLP followed by qualitative, it added context for the codes that you found in NLP. It detected emotions more reliably because there is semantic analysis, but it's a little bit more nuanced when you add the qualitative. But it added a lot more time, and most specifically, what that time looks like is this. NLP only 40 minutes compared to 270 minutes if you did qualitative. Now, if you go NLP first, followed by qualitative, it's actually even a little bit less than traditional qualitative, so you still save time, 220 minutes. But then if you do qualitative first, followed by NLP, you're up to 390. So what are ways that we can work in teams to use kind of this new analysis to save us a tremendous amount of time, potentially, in the qualitative work, while also actually adding more, adding richness? And I can say from our own work, we found this as well, where we looked at using a computational analysis approach, and this is just doing clusterings with single word frequencies, okay? There's no weights to these vectors, and there's no kind of either to the distance or the frequencies of the connections. But just looking at basic clustering, we found that looking at a helpline in Gujarat, we could look at 80,000 records versus what my team did in a basic traditional qualitative approach was 1,000. And we can look at all that data, and we still found really interesting clusters that I can tell you when this was presented to me by our CS end of the team, they didn't have meaning to associate with it, right? So what does it mean for runaway parents, in-laws today? Well, what it was is when we looked at the data from the traditional end, these were young girls that were interested in quote-unquote love marriages. They wanted to choose who they wanted to be with. And the only way they could do that was they had to run away. So they were calling it a moment of crisis, a point of decision. But you don't know that necessarily without knowing more about that. And so this is when you bring those approaches together, you certainly can do a lot more. And another way of looking at this, we can find new data sets. So what this was a team that looked at records from a police system in New Wales from 2005 to 2016, and looked at over 350 records, 350,000 records. And again, I'm not going to get into kind of the algorithms that they developed, but I want you to look at the process. So what they did was they took records that were labeled as domestic violence. So these could be assaults, these could be parole violations, these could be kidnappings, but they were just labeled as domestic violence. And then what they did was they worked with domain experts, that's you and I, right, to look at it and say, okay, how would you label these as abuse type? How would you label them for the injuries they had? And then together, they came up with dictionaries and rules, and then that's what they trained it on, okay? They took some of that data based off of that to understand picking out abuse types and injuries, and then they tested it. And what they found was this. It had a 90% precision for the codes that it came up with. That's pretty good. If you ever do stuff where you're coding with another person, what do your kappas usually look like? How much agreement do you usually have? 90% is pretty good. And then what I found most fantastic is you're never going to see criminal justice data labeled like this, right? Enormously rich data set. And look at this, emotional verbal abuse. Now you have over 100,000 records that are labeled that way. It's a data set you would never have access to. You would never know to look. You wouldn't know where to look at it. And suddenly you have a new rich data set. Now, what if we switch this from criminal justice to other new data sets like social media? And this is an area that's just kind of getting started of how do we approach an extremely rich but extremely unstructured data set. And so what this group looked at, and this is, I believe, only from a couple years ago, is they looked at Facebook pages that were focused on domestic violence. So that's where the data set came from. What's pre-processing is they cleaned up the data, and especially if you're ever working in an area where English is working as a second language, there's a lot of cleaning to do. And then they did feature selection. So that's what this is over here. So when it goes through and looks at the language that's being used, how would you kind of put these words into different categories and then classify it? And so based off of those different words, it looked at different kind of categories that they kind of presupposed by working with their domain experts of posts that were about abuse and posts that were about advice, which meant kind of more like, you should do this, not that I'm seeking advice. And what words were most associated with it? So for example, abuse was very much about present day or past events. So focus past 7, focus present 7. Very high numbers, very high associations. And very focused on somebody telling their story. I, me. Whereas advice things were about things that you should do, either in the present or future, and then again had certain positive or negative emotions to it. So you can see how it can begin to categorize that. So if we can come up with a way that's precise, and they're still working through this, and I can tell you from a different data set they've worked on, it can be more difficult as you get along in the kind of larger postings like Reddit. What if we could do something like this? What if we could take it to EHR? So this is something, again, from the mental health literature from psychiatry, where what they did was they looked at EHR records, and they were able to kind of give a score for suicidal behavior, so suicidal risk. And what they found was that if they compared case subjects, so people who eventually got coded as suicidal behavior, versus control subjects who never had that as a coding, they scored very high based off of their algorithm early on and maintained that. And what they found is that if you look at those scores, things that would be above of their threshold, they detected suicidal behavior 4 years earlier than it was ever actually coded, right? So when we're doing research now, we're doing research by ICD-10s, what are we missing? We're missing 4 years worth of data potentially. On the patient side, what are we missing? Are we only recognizing and willing to call it suicidal behavior much later than when they're actually showing risk, and that we're recognizing it because we're documenting something that we can actually code for? But there are challenges, right? And I think I've brought some of these challenges up already, but I want to talk about them more directly. And these are 3 key areas. There are definitely more. Data availability and quality, trust, privacy, ethics, and ownership, okay? So data availability and quality. When we think about EHRs, if any of you guys are working in the clinical setting in global health, I think this 40% is quite high. I think that is an incredibly generous estimate, but this is what was in the literature, so I'll put it up there. But in addition to that, there's the quality of the EHRs. There's the availability of it. Is it electronic, or do I have to enter this in by hand? And pray that there will eventually be good optical character recognition where this is automated. But also, there's low availability of additional data sets, right? So if we want to build big data, if we want to give some more contextualization, what are the data sets out there? Dr. Ellsberg mentioned earlier about DHS. Great data set, gives us population level data, but it has its flaws as well. Additionally, if you're doing natural language processing, as soon as you start working with a group where they're using it as English as a second language, all the things that you've learned about the semantics and the syntax that you're using when you're coding it as somebody who's an English primary user, that goes away. And you have to relearn the system. And it can be difficult, so you can't use certain approaches in the same way. And then these last 2 I want to talk about because it's really about what you put into it, right? AI is going to reflect bias in the training data. So if you have a training data set that is biased because it reflects only this segment of the population that's going to use healthcare, only this section of the violence or the population that's going to seek out help, it's going to be reflecting the training data, and it might skew what you're seeing. And are we collecting the right data? One of the questions I'm personally interested in right now is how do we understand kind of the greater environment in which people seek help? How do we understand safety? How do we understand trust? But no one's collecting that data, right? Or they're collecting it in a way that I can tell you, at least within the US, is heavily biased. And I think that relates to this second concern of ethics. What is the equity in distribution and burden and benefit? And I love this quote. This is actually from a US-based publication looking at big data for social justice change. And what they say, and this is kind of a much more eloquent way of saying garbage in, garbage out, But what they say is this, is that without civil, constitutional, and consumer protections for the era of big data, automated decision-making exacerbates these conditions by reducing fairness and reinforcing systems of hierarchy and privilege, resulting in high-tech racial profiling. Again, different groups use social media differently, they're regarded differently, their access is different. And if that's part of your training data, it's going to reflect that. And again, this is why we need people, the human element to AI. Moreover, there's also concerns for ownership and safety. So much of the health data that we may be working with is going to be government-owned. So does this allow people to be pinpointed, to be profiled? And again, what I was mentioning with the bots, is there safety issues when the access is mostly shared? And then what are the legal implications, right? If you disclose violence, whose obligation is that to notify someone for help? Is there an obligation? You know, oftentimes in the work that we've done on burns and we look at, do women seek help? Do they disclose it as an intentional event? They don't, because they don't want to implicate the legal process. But there are groups working on it. So the UN started this group, Global Pulse, to look at specifically how does big data interact with the SDGs. What I thought was interesting is when it came to gender equality, it looked only at finance. And so there isn't actually a conversation happening at this level. And I went through their whole list of kind of key projects they're looking at. None of them are about violence. None about mental health for women. But they are working on kind of the safety issues, looking at the ecosystem catalyst. How can they help push forward policy, advocacy, and adoption? And then finally, it's about trust. If we want women to use these interventions, we have to have them trust in it. And if you're not using mobile phones for SMS, are you going to trust in using a conversational agent? And again, I can tell you this holds true from looking at service delivery characteristics that will influence whether people actually use the help-seeking or the support services that are out there for gender-based violence. It all comes down to feelings of safety, empowerment, and trust in the system. So that's a lot, and I know we don't have a lot of time. So what is our path forward? Well, the first thing I think that's important to understand is if you're like me and you're a little bit technology adverse, this is where a lot of people are focusing, okay? And I think that there really truly is enormous potential for it, and it's when it's grounded in a public health viewpoint and a human-centric approach. So recently, this is just April 2019, the USA came out with this artificial intelligence and global health document. It's really fantastic. I encourage you guys to read it. Again, I like it because it's really not about being high tech, right? It's about leveraging these things in the right way to meet people kind of where they are. And when you look at where they see the priorities of where AI can be used for health, these are the ways that I see it, the work that can be done for violence against women fitting in with this, which is self-referral triage and personalized outreach, behavior change, how can we promote resiliency and improve mental health through self-guidance and psychiatric counseling, and what I would add is clinical decision support. Again, people may be thinking about violence when they talk to their patients, but not documenting it as such. So can we start promoting behavioral nudges to say, hey, maybe this is somebody you want to formally screen, right? Or hey, maybe this is the time you want to reach out for help. Not saying that this is happening, not labeling you, but a little behavioral nudge. And finally, when it comes to putting together teams, there are principles out there. This came out in 2014 after a number of different kind of documents came out. A large number of international NGOs got together to form what's called the digital principles. And specifically, I just want to talk about a few of those. This one is about designing with the user and understanding the existing ecosystem. There is a role, and a critical one, for qualitative research and community engagement. When we do these teams, it's about really bringing voice of the women who are experiencing, who are survivors, into the process and including a wide range of voices. And this is an iterative process with the community. Finally, things need to be data-driven. Not everywhere has a data culture, so how do we promote local sovereignty in data? How do we promote a local idea of ownership and what it means to drive forward data-driven, evidence-based interventions? And understand specifically that risks are highly contextualized. What we may consider risk here may make us blind to what is a risk in another setting. And finally, be collaborative. And this is what I'm going to leave you with. And I apologize if I've run a little bit long. But this is a team sport. It is the way that this can be best done, that can best benefit the women that we want to serve, is by working on teams, and teams that have diverse experts, and that not only kind of document the results, but document the processes of how we can be doing this better. So I want to thank you guys for listening to this very new lecture, but I hope that it excites you about taking new approaches to the work that you've been doing. Even if you're like me and you're not necessarily a CS person, this is something that you can help the conversation move forward. So thank you.